Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker and world-renowned orthopedic surgeon, Dr. Alfred Bonati. We have an exciting show lined up and a lot to get to. Let's get started. Over 100,000 Americans of all ages are killed by fentanyl each year, with projections of up to 200,000 Americans by the end of this year alone. Joining us to discuss is Jason Sheppard, an American entrepreneur who has stepped in to combat the fentanyl crisis by providing the only over-the-counter dip test that's approved by the FDA. Welcome to the show, Jason.
Thank you so much for having me.
So very quickly, can you give us a summary of fentanyl, what it is, what it does, where it comes from, and why it's such a crisis right here in the U.S.?
Yeah. First and foremost, the crisis, I believe, is coming. Obviously, the border needs to be looked at certainly a lot more than it is right now, and obviously get the illegals and these gotaways that are actually packing this stuff on to them and bringing it into this country. Fentanyl is actually a man-made opiate. It's derived from, certain chemicals that are actually end up being, depending on the grade of this, it could be 1,000 times stronger than heroin, which is why you're seeing the overdose deaths, and obviously the powder forms and things getting on your skin when you absorb such can actually cause accidental poisoning. So yeah, we wanted to make a difference and step in and actually get things out there that can stop this. And awareness needs spread first and foremost, and people need to educated on what fentanyl is and how this can actually affect their lives. Because
they only need a smidgen of it for it to be fatal, correct?
Yes, that's correct. Our tests go to 1 nanogram per milliliter, which is basically a grain of salt. So, and that's also on our harm reduction tests, which you can test any surface. Like you said, the smallest amount can get on your skin. But our test, the harm reduction test, is one where you can actually test any surface. You can test any substance all the way down to liquids. And you don't have to actually dilute the entire substance or anything of that nature. So it preserves it for evidence for crimes. And with the FDA clearance, it's going to be recognizable in criminal court.
You have sort of famously blasted what we call the Biden regime over the handling of the border. And obviously, fairly recently, he came out with, we are going to lock it down. After 3.5 years in an election year, now he decides to do something. And even that something isn't nearly enough, in our opinion. What are your thoughts on his latest actions on the border, or inactions, if you will?
Well, so it's been in action the entire time. I mean, let's be honest here. For 3.5 years, it's been nothing but let's let people in. Yeah, I believe you're referencing that they're going to lock it down at $2,500 a day, which is still $75,000 a month after God knows how many illegals have gotten through at this point in time and how many gotaways, because, I think we're probably well into the millions that we cannot account for. And these aren't just people coming from, Mexico and South American countries. These are China. Chinese individuals, nationalists, and China is a huge fentanyl market. There's no doubt about that. That's where chemicals come from to make this. So it's like that border is straight up under attack. And honestly, I believe we need Trump in there to change that.
So why don't you tell us about your company's fentanyl test? How does it work? You said it doesn't need to be diluted, but it can work on surfaces and on a person, correct?
Yes. So if a person has any residue or anything on their cells, yes, absolutely. It'll pick up all the way to 1 nanogram per milliliter. So it's hard to demonstrate this right now, obviously. But so these tests, they come into a little packet. The harm reduction tests also have a buffer so if a police officer or anybody rubs the test into a powder, all through the powder, or they just basically put it on a surface, they could dip it into a gel, paste, liquid. It tests everything. Within 5 minutes, these are going to come back and tell you at over 99.4% accuracy. So that's why it's very important, because I know police have fentanyl protection gloves, but a lot of people don't. Right. And it's literally, it goes right through those gloves and it will kill you. These right here, these are actually the institutional version of our over-the-counter. So the only thing that comes is different. This one does not come with a cup, because most prisons and most probation officers, parole officers already have a contract for cups. So we sell these in lots of 25 for them, so they can actually get these to their wards, so to speak. And this is another thing we were talking about, why the overdoses are so high is, again, these addicts, unfortunately, they know how to beat the system. They know they're going to, urinate dirty for oxycodone or any other opiates, but they also know their probation officers not testing for fentanyl because they have to send it out. And it could cost up to $80 to $300, per test, and in 3 weeks of lab results. So.
Jason, explain to me, if you will, and we've discussed fentanyl at length, ad nauseum almost, because it's just nothing seems to happen to curb what's going on with this drug. But I guess it's really hard to wrap your head around how something that is so deadly in such a tiny, tiny speck. I just don't understand how it's like a recreational drug when it's this toxic and deadly.
I really think it wasn't even meant to be a recreational drug. It's more or less these dealers are lacing their products with it, and things coming across the border. I don't think any dealer wants to kill the people that are paying them and buying their substances, but to make their substance more addictive and make it stronger, because once you're at a very high level of addict of an opiate, the term is keep chasing the next high. It's something that, I don't understand as an addict would want or like, but it's in pills. They can snort it. They can shoot it. Actually, they're smoking it now too, to be quite honest with you. They're starting to lace marijuana with fentanyl. So, you can get it in liquid form and spray. There's a lot of things that it can be taken as, including just, straight ingestion. We want to save people's lives. And we're not going to sit here and advocate drug use. We're not. Right. But we're also not going to we're not going to be able to stop that. We're not going to be able to curb people utilizing this. But, for $5, they can test their substance and it will not ruin that substance. So it's a way for addicts to actually make sure they're safe too and not ingest this. So we would like to have this actually on the street. We really would, because this is one, crack is generally not going to kill anyone. Fentanyl will. I mean, you have basically one chance. And if you're not getting it medically regulated, you really have no chance to actually be able to survive that.
And where can people learn more?
So since it's the only test, we have it up at thefentanyltest.com. You can, actually purchase there. You can read all about it. You can see our FDA clearances and, read all about the science behind this and, what cross contaminations and things, our test actually also eliminates.
Thank you so much for being on the program, Jason Sheppard, and keeping everyone safe in our country from fentanyl.
Thank you so much. I appreciate it.
Stay tuned. We'll have more on American Medicine Today.
The loss of coordination in my legs, I'd trip over my feet, end up flat in the concrete. Dr. Bonati to me was God sent.
Walked like that in a while. I don't remember how long.
I didn't have to make a massive lifestyle change. I noticed today that I could sit and stand up without a cane. I would have to give it excellent and above my expectations.
Visit AskBonati.com.
When I had my fusion surgery about 4.5 years ago, that's when I lost the feeling in my leg and foot. I was off work maybe 8 weeks with that surgery. As far as coming to Bonati, right after surgery, I had feeling in my leg again. Hadn't felt it in 4 years. Oh, that was a great feeling.
Thanks to the exclusive Bonati Spine Procedures, Bill is looking forward to getting back to his busy life.
I work 2 full-time jobs. I'm a maintenance supervisor, diesel technician for Penske Truck Leasing. And I also teach diesel mechanics. I'm the diesel technology instructor at East Arkansas Community College. I like to fish, hunt, tinker around in my shop or on the farm, taking care of my cows. My pain started quite a few years ago working, lifting stuff heavier than I was supposed to, or I was Evel Knievel as a kid, four-wheeler, wrecks, whatever, I lost a lot of sleep because of the pain. It did mess with my social life, going out with friends. I didn't want to hang out a lot because I'd be worried I was going to hurt and I wouldn't be more sociable, so I wouldn't go out with friends a lot. As far as work, I just pushed through work. At the end of the day, I come home and then it'd be excruciating pain.
Bill tried numerous conservative treatments to relieve his pain, but when those failed, he underwent a spinal fusion, resulting in numbness down his leg and into his foot.
I went to chiropractors, physical therapy. I had deep tissue massages. I had a spinal cord stimulator installed. About 4 years ago, I had a fusion.
Desperate for an end to his pain, Bill learned about the Bonati Spine Institute and started doing his research.
I was looking online, doing my own research about the Bonati Spine Institute and seeing all the videos from previous patients who've had success stories.
At the Bonati Spine Institute, the patient is the priority.
It was all about me, I'm the patient. Let's get you taken care of. We want to get you back out into your life. And that's how the whole process was.
The Bonati Spine Institute's patient-focused care is reflected in their state-of-the-art imaging center and its ability to deliver X-rays and MRIs for review minutes after they are taken.
The one-stop shop process here is a whole lot better than I've experienced over my past 4 years with surgeries. They went in depth. They were all about me, making sure all my questions were answered. We did the MRIs. We did multiple scans. He pulled up each level he was going to work on and showed us on the models on the screen what and how he was going to take care of and relieve pain and what was causing the pain.
Another unique benefit of the exclusive Bonati Spine Procedures is the patient's ability to communicate with the surgeon during surgery to ensure the source of their pain is eliminated before they leave the operating table.
I was alert and was able to see everything he was cutting out, moving. He showed me the nerve. He showed me each little thing he was doing. Even laying on the table in the operating room when they finished and they were unhooking everything, I could feel my leg. So it was like night and day between what that morning was like and then after the surgery.
Patients of the Bonati Spine Institute are often surprised by how quickly they are able to be up and walking after their procedure.
Kind of got up out of bed by myself and I was ready to walk. I did the high steps, I did tippy toe lifts, everything they wanted me to do, I did it. Out the door we went and back to the motel.
Bill highly recommends the Bonati Spine Institute to anyone suffering with neck or back pain.
From my experience with everything from the Bonati Spine Institute, I've already called one of my friends yesterday after my second surgery and let him know how I was doing, how I was feeling, and I recommended him to the Bonati Spine Institute because of my success. He's been having back issues for over 30 years.
After the targeted Bonati Spine procedures, there is no hospital stay, uncomfortable brace to wear, or suffering through weeks of physical therapy. Instead, surgical guests are told to walk around 40 minutes a day.
I didn't have to wear a brace, so that was good. They want you to walk at least 40 minutes a day, which I think I've tripled or quadrupled that because I've been walking down the halls and up each stairwell of the motel a few times a day since surgery.
Well, I still
right.
appreciate it.
Very good and good trip back.
All right, thank you.
Give me a call location.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Apple's App Store, Google's Play Store, Roku, and Amazon's Fire TV. Welcome to American Medicine Today. I'm Kimberly Bonati alongside Dr. Bonati, and we're excited to talk about how doctors can actually monitor spinal cord activity during surgery. I mean, how is this possible?
For a long time right now, we are practically moving technologies that allowed us to visualize the human body. There were the X-rays, then there were the MRIs. Then they got a little more aggressive. They start to use arthroscopes. Then now they're using special scans. And recently they are modifying the scan and is a mobile type of scan that travels around the body and can practically allow the surgeon to see the areas that the naked eye will not be able to see.
Why is it important to happen during spinal surgery?
Well, because it's a tremendous amount of difference in the treatment of a spine. When I read this article, I go, well, this is a millions of dollars expenses in an instrument. We can do cheaper and better. Mm-hmm. Maybe not with the tremendous technology and all the fancy things that you would need to use. The arthroscope can do the job. And the arthroscope is cheap.
Okay.
Then the tubes that we develop in our institute many years ago allowed you to travel wherever you want to go if you really know where the problem is. And that one can be done by studying the patient problems and the locations of the problems. And once you know where you are, the arthroscope will be your best friend to take a look together with those tubes. So in spine surgery, it's amazing to see how poorly the results are and how bad the developments are coming through.
You mean just in general?
Yeah.
Okay.
When you do spine surgery, you expect that the patient will be okay. Well, this article that they are talking about is a mobilized scan that moves around, but it's for back pain. They are trying to cure back pain. I can cure back pain in an hour.
Right.
With the techniques that we develop.
Yes.
And really, the cost is, in comparison, almost
Minimal.
zero.
Correct.
So when you start to talk about back pain, one of the things that we do at the Institute is remove back pains every single day.
Right.
And the results are permanent, and they are excellent results. And the damage in the spine is minimal. But they're also talking to do these type of procedures. When you do spine procedures, you need to put the patient to sleep. Because when you talk about certain advances right now on the market, they are talking about to use fusions. And they talk about minimal invasive fusions.
Okay.
What is a joke? Because it's not minimal invasive.
No.
Because you need to do a cut in different levels. And then after that, they need to put rods and they need to put some type spacers.
We'll have more after the break and continue the discussion on the spine care industry. Don't be screwed by lesser spine institutes who bait you with minimally invasive procedures, then switch to screws, rods, disc replacements, and hardware. At Bonati, no metal hardware fusions are ever used. Bonati invented the precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect 98.75% patient satisfaction. Over half our patients have suffered from failed back and neck surgeries at other facilities. Bonati succeeds where others fail. Welcome back to American Medicine Today. We're continuing the discussion on spinal care with Dr. Bonati. So now I see where you're going with this monitoring device. They're spending millions on it, which means the skyrocketing prices of fusion spine surgery, when yours can be done, as you said, through the arthroscope and then those dilating tubes that you developed. And with your specific procedures, you have minimal cost and you're able to do all of that with your conscious IV sedation. So really, this is just a waste of money and something to cause those prices to skyrocket.
We know that it's around 30% of the humanity has back pain. And reading articles and something, they describe that is uncurable. The problem is you need to know the anatomy and you need to understand where the problem is coming, and that is what you need to correct.
Right.
Okay, I just have experience yesterday in a patient who had another problem. And another surgeon came and asked why I cannot fix this pain. And then we worked together and we fixed the pain in an hour. So the problem is you need to know where you need to go.
Right.
I am extremely blessed because I have 80,000 procedures. So I have a tremendous amount of knowledge because every patient taught me something. And everyone who taught me something, I apply to see if I have a repetition of that result.
Right.
And I do. And when I do, I use it. My patients have what we call today conscious sedation.
Yes.
And there's not the That is the way that everybody should operate the spine. And it's not there.
Correct.
And when you start to see these fusions, I understand why they need to do general anesthesia. Because if you need to put the instrumentation on the stomach through the abdomen, and then you need to go through the back, and then you need to go to the side, yes, the patient needs to be practically dead before you put all these things there.
Yeah.
The problem is you don't need that.
Correct.
My patients come to me with tremendous different types of problems and are being solved very much in the same way that I do the procedure. And the procedure, the result of this procedure is beyond what the market delivers today.
Correct. It reflects 98.75% patient-reported satisfaction. If you would like to find out if you're a candidate for the exclusive and patented Bonati Spine Procedures, visit askbonati.com. Thank you for watching American Medicine Today. Make sure you check us out anytime, anywhere by downloading our American Medicine Today app on your streaming devices. If you have any comments or questions, contact us at the numbers below. Or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you.